My name is Dr. Eugene Tuishimi. I'm Associate Program Director for Research at Anesthesia, Critical Care and Emergency Medicine Department at the University of Rwanda. Thank you for accepting our abstract. The title of our project is Burnout Syndrome Among Anesthesia Providers Working in Public Hospitals in Rwanda, a cross-sectional study. I don't have any conflict of interest to disclose. For our presentation, we look at the introduction about burnout. We look at the major contributors and the consequences of burnout. We see the rationale and the objectives of our study, and briefly talk about the results and the conclusions. What is burnout? You are at high risk of burnout if you have emotional exertions and depersonalization. On top of that, if you have a raw sense of personal accomplishment, adding on high emotional exertion and depersonalization, you have burnout syndrome. What are the main drivers of burnout? There are many drivers, including workload and job demand, control and the flexibility about your work-life integration, social support in the community at work, organizational culture and values, efficiency and resources at workplace, and meaning in our work. On top of those drivers, there are consequences if those drivers are not improved. At a personal level, or you may have broken relationships, alcohol and substance use, depression, and suicide. At professional level, you can have a decreased quality of care and increased medical errors. That may decrease the patient satisfaction and also decrease productivity and professional effort, and also increase physician turnover. What was the rationale for our project? Actually, there is positive data on burnout among anesthesia providers in sub-Saharan Africa. And there was no single study of burnout among anesthesia providers which has been conducted in Rwanda before our study. And the main objectives of our study were to evaluate the prevalence of burnout among anesthesia providers in Rwandan hospitals and to determine factors associated with burnout among anesthesia providers in Rwanda. We used the Maastricht Burnout Inventory Human Services Survey questionnaire, and we sent it to 137 Rwandan anesthesia providers, both physician and non-physician, working in public hospitals from September to November 2018. The burnout was defined as being present if an individual scored more than 27 score on the emotional exertion subscale, which was high, or either having high depersonalization or low personal accomplishment. Also, social demographic and work-related factors associated with burnout were assessed using logistic regression and a Bayesian framework to estimate the odds ratio and associated credible intervals. For the result, the prevalence of burnout was 26.3%. And using the burnout subscales, we can see that 44% of our participants had high emotional exertion, 80% had high depersonalization, and 13% had low personal accomplishment. Among factors associated with burnout, we see that lack of the right team was statistically significant, and also seeing patients with negative outcomes, that was statistically significant as well as factors leading to burnout. In conclusion, in this cross-sectional survey of anesthesia providers in Rwanda, more than a quarter of respondents met the criteria for burnout. And lacking the right team and seeing negative outcomes were associated with higher burnout rate. These identified factors should be addressed in order to prevent the negative consequences of burnout, such as poor patient outcomes. Thank you very much. For further questions, you can contact me at my email at tuyishime36@gmail.com. Thank you.